You are listening to Pulse, the Heart of Nursing, a podcast series on research at the Ellerslie Centre for Nursing Studies at the National University of Singapore. It is important to recognise the significance of psychological health in chronic disease management. Patients who suffer from depression and anxiety may find it difficult to manage their condition. Therefore, it is essential to consider the mental health factor when developing strategies to promote self-care. This is what we will be touching on today. Here with us today is Dr Jiang Ying, an assistant professor from the Ellerslie Centre for Nursing Studies at the National University of Singapore. Dr Jiang Ying is a registered nurse and registered mental health nurse in Singapore. Her research interests are in chronic disease management, cardiovascular nursing, cardiac rehabilitation, and mental health. She has published multiple peer-reviewed papers in the top international referred medical and nursing journals with good impact factors. Today, Dr Jiang Ying will be sharing with us about how we should consider the mental health of patients while managing their chronic conditions. I am Hadassah Joann Ramachandran, a PhD candidate and your host for the podcast today. Chronic disease may be invisible to the naked eye, but its impact on individuals and their families is anything but hidden. Hello, Dr Jiang Ying, and thanks for taking the time to meet us in the studio today. Could you tell us a little bit more about yourself?
Hi Joanne, it's nice to be here. Hello, my name is Jiang Ying and I'm an assistant professor at Ellerslie Centre for Nursing Studies. Thank you for having me in this podcast episode. My research interests lie in the area of cardiovascular nursing, cardiac rehabilitation, chronic disease management and mental health. I'm particularly interested in explore ways in which psychological health can impact self-management and care of chronic disease. Additionally, I hope to investigate potential intervention and strategies that can improve psychological well-being and overall health outcomes for those living with the chronic disease.
Yeah, psychological well-being is indeed linked to physical health and is especially important in diseases with a chronic nature. Dr Jiang Ying, how did you decide on chronic disease management as your research focus?
Well, I was caring for a patient with chronic conditions. Let's call him Tom. Yeah, despite our effort as a healthcare professional to guide and support him, Tom seems indifferent or resistant in following our advices or taking care of himself. So I got this quite perplexed by this. So I just want to find out why. So as a nurse with mental health training, I'm fascinated by behavior patterns and their underlying functions. You become aware of recurrent behavior patterns and associate problems in some patients, which may not just simply be due to the lack of the information or knowledge. So this led me to explore the complex relationship between psychological factors, chronic conditions, and self-management. And I have embarked on a research journey in this area.
That's interesting, Jiang Ying. What are some of the challenges in chronic disease and long-term care that have sort of caught your attention and led you to come up with such ideas for your research?
Well, as healthcare professionals, we often discuss the importance of empowering patients or caregivers to take care of themselves. However, it's also important to recognize that patients' response to our advice or their behaviors, whether they take action or not, can be influenced by various psychological factors. Patients may be dealing with depression or anxiety related to their conditions or treatments, which can greatly impact their ability to care for themselves. Now, studies have been already shows that patients with chronic disease are at greater risk of developing mood disorder and anxiety. And conversely, depression has been linked to poor health status and clinical outcomes in patients with chronic conditions. Therefore, it's crucial for healthcare professionals to be aware of this psychological factor and provide support and guidance accordingly. I feel that in chronic disease and long-term care, our focus is not just on the service we provide, but also on how we deliver the message and interact with patients. It's not just about the content, but also it's about the form and the process.
That's interesting. How did you start your research journey?
In my earlier research, I studied the psychosocial factors that impact patients' quality of life and their ability to manage their disease. I also explore potential interventions to improve psychological health and clinical outcome for individuals with chronic conditions. So as part of my PhDs, I investigate the effectiveness of psychological interventions to enhancing patient self-care and overall health outcomes, specifically in the context of chronic heart failure. So the approach of multi-component psychosocial intervention turned out to be quite promising. We published the findings in the International Journal of Nursing Studies.
Wow, interesting. I'm just curious though, what does this multi-component intervention look like, and how has your research journey sort of evolved since its early stages?
Sure. Actually, over time, my research has expanded to include like community-based interventions, and I'm also exploring innovative approach to promote health and secondary preventions. So I have had the opportunity to collaborate with a multidisciplinary team and engage with community partners in carrying out some of the research projects. Recently, digital and technology solutions have tremendous potential to transform health promotion and secondary prevention efforts in the communities. It's an exciting area to explore and an important element in create effective interventions. As I'm interested in interventions that offer both psychological and physical benefits, such as Tai Chi, Qigong, and dance. Therefore, I see some potential in combining these elements to promote health among people with chronic conditions in the communities. Lately, I have been working on a research project to pilot test the effect of a dance-based exercise and game or exercise game on improving function, psychological well-being as prevent falls in seniors. So dance is a very good neuromotor cognitive exercise where one's body moves along with familiar music and rhythms. It evokes a certain sense of emotional resonance and a feeling of joy and pleasures, making dance probably one of the better forms of exercise for both physical and mental health. With the new way in tracking body pose with machine learning, and we are able to provide instant feedback to the participant and evaluate their progress. So this approach not only enhance the exercise experience, but also potentially for monitoring gait steadiness and analyzing trends to detect early signs of gait abnormalities. So the project is still ongoing, that we are still collecting the data, but we are quite excited to know more about and see the development of such an approach.
And we're equally excited to hear all about it when the project is complete. Digital health is like all the buzz right now, and it's promising to see nursing research harness technology to support both psychological and physical health in chronic disease management. Thank you, Dr. Jiang Ying, for the insights and for joining us today. And we are wishing you all the success for your ongoing projects.
Thank you for having me. It's a great pleasure to discuss my research effort in chronic disease self-management. I hope our discussions encourage listeners to recognize the significance of psychological health in chronic disease management and stimulate some thinking about finding new ways to promote health in their communities.
Thanks, Dr. Jiang Ying. You've been listening to a podcast considering mental health in managing chronic diseases with Pulse, the Heart of Nursing, a podcast series on research at the Ellerslie Centre for Nursing Studies at the National University of Singapore. With us in the studio today was Assistant Professor Dr. Jiang Ying, speaking with us on chronic illness and long-term care. I am Hadassah Joann Ramachandran. Thank you. Until the next podcast.